Good evening, everyone. Our presentation is on White County. Our team consists of Chandler, Will, Megan, Pavana, and Elizabeth. Here are some quick facts about White County. It gets its name from the White River, which forms its eastern border. It is the second largest county in the land area in the state. And some of the notable towns in this county include Searcy, Beebe, and Bald Knob. So let's talk about the demographic takeaways for White County. Of course, the white population is the majority in this county. The non-Hispanic Black population is much more of a minority compared to the state's proportion, and so is the Hispanic race or population, I'm sorry. Change differences in racial makeup of the population correspond to the majority rural population. So in White County, there's about 54.3% versus Arkansas is quite a bit lower. It's 43.8%. And then the median household income is comparable with state average. However, it's a major disparity when we're looking at races. So as you can see on the slide, it tells us that Blacks and Asian households bring in almost 40% less than white households. And although Hispanic households seem exempt from as harsh as a disparity with only around 11% difference, the percentage of children in poverty tells us a different story, where 46% of the Hispanic children live in households which fall below the poverty line compared to the 27% of Black children and the 17% of white children. Health outcomes. So for White County, it's ranked 13th out of the 75 counties in the state of Arkansas in health outcomes by county health rankings. It's ranked the same in length of life and quality of life. And the trend given here shows the measure of premature death rates in White County. This measure focuses on deaths which were more likely to have been preventable than the general mortality rate by only measuring those under 75 years old, when risks of the poor health outcomes rise significantly. White County dropped below the state average in this trend. However, the trend does not show racial disparities for this measure. So just for other insights, the years of potential life lost for Blacks is 11,400 and for whites is 9,000. The next topic under health disparities are risky behaviors. And so risky behaviors are anything that can cause you harm in any way. White County is also seeing a rise in some measures of risky health behaviors like sexually transmitted infections and diseases. Though it still falls below the state and national averages, we are seeing some upward trends. On the other hand, other measures of risky behavior like alcohol-impaired driving deaths are improving, and this measure has been erratic through the years, but a stable and significant trend downward puts it well below other averages, and so we're happy to see that. The next topic is access. The number of uninsured adults and children in White County has paralleled state and national trends since 2013, which will be explored more in detail in our section on the ACA. Similarly, the number of providers in White County has remained stable, which is not a positive thing for White County due to its more spread out rural population. For example, White County has 0 general practitioners and only 5 OBGYNs, whereas the state sees an average around 1,500 to 1 for primary care physicians, and White County is almost at that 2,000 to 1 ratio mark. The gaps are similar in dentists, mental health providers, and the number of preventable hospital stays. Despite its geographic size, White County only has 2 hospitals and they're both in Searcy. This contributes to White County's ranking at 32 out of 75 for health factors, with their clinical care ranked 38th. And the last healthcare disparity that I'll be talking about is the economic factor. White County ranks 34th in social and economic factors, and it also contributes to the lower health factors rank. Much of the economic and social disparities have already been discussed in the demographics section. Much of the violent crime illustrates a link between these factors and impacts on health. As you can see, the trend between 2013 and 2016, though lower than Arkansas state average, shows a much steeper rise in violent crime. Now we will take a look at the impact of the Affordable Care Act on the health status in White County.
The Affordable Care Act, formerly referred to as Obamacare, became a law after it was signed by President Barack Obama on March 23, 2010. This act represents the United States healthcare system's most significant regulatory overhaul and expansion since Medicaid and Medicare were enacted in 1965. It also extends protection to patients and their private information. The Affordable Care Act passed in 2010 and became a law on March 23rd. The insurance regulations and individual policy requirements took effect on January 1st of 2014. Some important provisions of the Affordable Care Act include that insurers were mandated to enroll young adults until the age of 26. It also extended coverage for pre-existing conditions. Health plans had to provide essential health benefits. A fee was imposed on insurers for the privilege of selling plans through exchanges. The minimum medical loss ratio of 85% for large groups and 80% for individual or small group plans was enacted. And there was an individual mandate requiring that all residents of the United States have health insurance or they pay a penalty tax. White County is the ninth largest county in Arkansas by population and the second largest county in Arkansas when considering landmass. In 2010, before the Affordable Care Act was passed, the health ranking for White County was 10, and the ranking for health factors was 15. In 2014, a few years after the Affordable Care Act had passed, the health ranking became a 9, and the ranking for health factors was also a 9. The rankings have moved up and down over the last few years, fluctuating. The state of Arkansas is one of the largest beneficiaries of the Affordable Care Act. RAND Research Analysis stated that by 2016, Arkansas had 400,000 newly insured persons. White County receives a percentage of funds allocated for the Affordable Care Act from the state of Arkansas. Arkansas receives about $430 million annually from the federal government for various Medicaid expansion programs that were taken up by the state. White County receives about $5 million in federal and state aid for these programs. The Affordable Care Act helped Arkansas and White County in several ways. With the insurance Medicaid expansion, more people now have insurance. The number of uninsured people in Arkansas fell by about 50% after the Affordable Care Act was enacted. The population percentage that was uninsured in White County in 2010 was 20%, and by 2016, they got that down to about 9%. In 2020, however, the percentage of uninsured in White County went up to 10% due to various factors, including change in the political landscape and talk of an overhaul of Obamacare. In White County, the population of primary care physician ratios in 2010 was 1,933 to 1. By 2014, we had that decrease to 1,915 to 1, and by 2018, it was at 1,920 to 1. This should have improved more through the Affordable Care Act, as there was a large emphasis on primary care. The Affordable Care Act helped White County a lot by extending coverage to people with pre-existing illnesses, because anyone with a pre-existing illness but that did not have insurance previously or could not afford insurance would now be insured. There are a couple factors which I believe hurt White County. One factor that I believe hurts the most is the end of the federal reinsurance program, and it hurts insurers as well by putting more pressure on them. The other factor that hurts White County is the penalty for mandate was not very harsh, and many people have opted not to have insurance if they did not qualify for Medicaid or if they did not receive tax credits for their insurance. With the changes in the political landscape, it will certainly be interesting to see how healthcare will change in the future, particularly for White County.
The health and demographic data from White County indicate that the county deals with food insecurity. According to the data, 17% of the White County population is food insecure. Food insecurity can stem from many different sources, like a lack of financial means or buying power to purchase food, lack of close and affordable grocery stores, and also a lack of knowledge about proper diet and nutrition. Food insecurity can lead to a multitude of chronic health problems. For children, food insecurity can lead to acute or chronic malnutrition, which often leads to developmental delays and leads to risks of being overweight, high cholesterol, and developing type 2 diabetes. In White County, currently 33% of the adults are obese and 17% have diabetes, indicating that food insecurity has been a long-term problem in the county. This also shows that the current adult population is experiencing the negative chronic effects associated with food insecurity. According to the data, the rate of children in poverty in White County is around 20%, and the rate of children currently eligible for free and reduced lunch is around 58%. The free and reduced lunch federal program serves breakfast and lunch to students meeting the income thresholds, meaning that impoverished children can receive 2 out of their 3 meals at school. Schools, therefore, are a major source of food for children and low-income families in White County. And the map to the lower right shows where all of the schools in White County are located. Other sources of food or food access points are grocery stores, churches, food pantries, farmers markets, or even household gardens. At food access points, people are able to obtain food for themselves and their families. And the federal and state governments have also implemented programs like SNAP, the Supplemental Nutrition Assistance Program, and WIC, alongside the Free and Reduced Lunch Program, to help low-income families become more food insecure. However, like in White County, food insecurity persists. And as previously stated, one reason is the inability to simply access a food store. The map on the upper left shows the distribution of all the grocery stores within White County. From the data and the available information about White County, we suggest implementing school-based food pantries to help improve food security. School-based food pantries allow for people and families and children to have access to culturally relevant, locally sourced food without having to take time out of their day to go to a grocery store and without having to pay for the food. School-based food pantries partner together local public schools, as well as the PTA, school nurses and gym teachers, and even local farmers to create locally sourced, ethnically available, culturally relevant food for families. And alongside this, these schools can teach about proper nutrition to students. We recommend that these diet and nutrition classes be offered to middle and high school students so that they can start choosing healthier choices within their diet and day-to-day activity. A great resource for this is to use myplace.gov. And you can also look at the PTA communication strategies like newsletters to communicate information from MyPlate. This could be whether it's sending out a picture of a properly balanced, nutritious plate, or even a link to the website and communication emails to parents. School-based food pantries are not new, but they're not commonly integrated into regular public school systems. However, because White County is so rural and there are such long distances between households and food access points, increasing the number of food access points with school-based food pantries is an optimal way to cut down the food insecurity in the community. Studies have been done in Chattanooga, Tennessee, as well as other areas of the country to determine how acceptable school-based food pantries are in the community. And these studies have shown that parents are relatively accepting of getting food from the school. Also, nutrition-based classes have shown that students, when education is delivered in age-appropriate format, can make behavioral changes and have made behavioral changes that support proper health, diet, and nutrition.
The group members representing White County would like to thank you all so much for listening. Please see the references to the right. Have a nice night.